Imagine walking into a hospital for a simple emergency, and a few weeks later, you receive a medical bill for $10,000. Sounds unbelievable? For millions of Americans, this is reality. The United States has one of the most expensive healthcare systems in the entire world. But here's the shocking part. Most people still don't fully understand how health insurance actually works. And because of that, they end up paying far more money than necessary. In this video, you'll discover why healthcare in America is so expensive, the biggest insurance mistakes people make, hidden hospital charges nobody warns you about, and legal ways Americans reduce massive medical bills. Watch until the end, because one simple mistake could cost you thousands of dollars overnight. Let's begin. Now, here is the catch. Most people assume hospitals are expensive because medical treatment is advanced. But the real answer is much more complicated. In America, hospital prices are often inflated far beyond the actual treatment cost. For example, a simple ambulance ride can cost hundreds, sometimes even thousands of dollars. An overnight hospital stay may cost more than luxury hotels. And basic emergency room visits can leave patients with bills larger than monthly salaries. But why? One major reason is the insurance system itself. Hospitals know insurance companies negotiate prices. So many hospitals intentionally set extremely high prices from the beginning. Insurance companies then negotiate lower amounts. But if someone doesn't have insurance, they may receive the full inflated bill. And that's where financial problems begin. Another reason healthcare costs are so high is administrative complexity. Insurance paperwork, billing departments, claim processing, legal systems, all of these create additional costs that patients ultimately pay for. And sadly, many Americans avoid doctor visits entirely because they fear medical debt. But even if you know these terms, a few wrong moves can completely ruin your savings. Let's talk about the mistakes that cost people the most money. Health insurance sounds confusing, but the basic idea is simple. You pay a monthly premium, and in return, the insurance company helps cover medical expenses. However, there are several important terms many people don't understand. The first is the deductible. A deductible is the amount you must pay yourself before insurance starts helping. For example, if your deductible is $2,000, you must first spend $2,000 on healthcare before your insurance contributes significantly. Next comes the copay. A copay is a fixed amount you pay for services, maybe $20 for a doctor visit or $50 for urgent care. Then there's coinsurance. This means you share costs with the insurance company. For example, insurance may pay 80%, while you pay 20%. Many Americans misunderstand these terms, and that confusion leads to unexpected bills later. That's why understanding your policy is extremely important. A few wrong moves can completely ruin your savings. Let's talk about the mistakes that cost people the most money. Mistake number 1, choosing the cheapest plan without reading details. Many people only compare monthly premiums, but cheaper plans often come with higher deductibles, limited doctor networks, expensive emergency coverage. So while monthly payments look affordable, the real costs appear later during emergencies. Mistake number 2, using out-of-network doctors. Insurance companies work with approved hospitals and doctors, called in-network providers. If you visit doctors outside that network, your costs may increase dramatically. And sometimes, insurance won't cover anything at all. Mistake number 3, ignoring prescription drug coverage. Certain medications may not be fully covered. Some Americans discover this only after arriving at the pharmacy. Mistake number 4, missing enrollment deadlines. Health insurance enrollment periods are limited.
If people miss those deadlines, they may remain uninsured for months. And one accident during that time can become financially devastating. Mistake number 5, assuming insurance covers everything. The reality is, even good insurance plans often leave patients paying large amounts themselves. That's why reading the policy carefully matters so much.
But guess what? Even if you make 0 mistakes and do everything right, the system can still blindside you. Here's something many Americans never expect. Hidden medical charges. Sometimes patients receive separate bills from doctors, hospitals, laboratories, ambulance companies, specialists, even after insurance pays its portion. One of the most controversial examples is surprise billing. Imagine going to an in-network hospital during an emergency. You assume everything is covered, but later, you discover one specialist was out of network. Now suddenly, you owe thousands of dollars. This situation has shocked countless Americans. Hospital pricing can also vary dramatically. One hospital may charge 3 times more than another for the exact same treatment. And unfortunately, patients usually learn prices only after receiving care. That lack of transparency creates enormous frustration.
This sounds terrifying, right? But don't panic. There are legal ways to fight back. Let's discuss something incredibly important. How Americans legally reduce medical bills. First, always ask for an itemized bill. Medical billing errors happen more often than people realize. Duplicate charges, incorrect treatments, billing mistakes. All of these can increase costs unfairly. Second, negotiate directly with hospitals. Many hospitals actually offer discounts if patients ask, especially for uninsured individuals or people paying immediately. Third, use in-network providers whenever possible. This single decision can save thousands of dollars. Fourth, compare prescription prices. Sometimes the same medication costs dramatically different amounts at different pharmacies. There are also discount programs many people never use. Fifth, take advantage of HSA accounts. HSA stands for Health Savings Account. These accounts allow Americans to save money tax-free for medical expenses. And over time, those savings can become extremely valuable. Finally, never ignore medical bills. Many hospitals offer payment plans, but avoiding bills completely can damage credit scores and create legal problems later.
When you look at all these crazy rules, charges, and loopholes, it makes you wonder. This debate continues across the entire country. Some people believe America has the best medical technology in the world. Others believe healthcare costs have become completely unreasonable. The truth is, both arguments contain some reality. America offers advanced treatments and highly skilled doctors, but millions of families still struggle financially because of medical expenses. And until healthcare becomes easier to understand, many people will continue overpaying unnecessarily. That's why financial education about insurance matters more than ever.
Health insurance may seem confusing, but understanding even a few basic concepts can protect your finances and your future. One emergency, one accident, or one hospital visit could completely change someone's financial situation overnight. That's why learning how insurance works is no longer optional. It's essential. If you found this video helpful, make sure to like the video, subscribe to the channel, and turn on notifications for more smart money and insurance content made simple. And comment below, what's the most shocking medical bill you've ever heard about? Thanks for watching, and we'll see you in the next video.